Okay, so imagine you're walking through the grocery store, just pushing your cart, and all of a sudden you hear a cry out for someone who knows CPR, which is known as cardiopulmonary resuscitation. You think to yourself what probably most people would think, like, oh, there must be a nurse or a doctor here that knows CPR and can help out. However, in Liz Young's case, she was the only one who knew how to perform CPR. So she stopped what she was doing and helped the woman as fast as she could, and helped gain the woman's breaths back until EMS arrived to help the woman. According to the American Heart Association, only about 1/3 of Americans feel comfortable enough to actually perform CPR on someone else. As an EMT, I'm in EMT school, on my clinicals, I've seen 2 instances where CPR has helped save someone's life. And so CPR is a critical skill that everyone should know and understand so that if the opportunity arises, you can perform adequate compressions to help save someone's life. There's only 2 steps you really need to know for hands-only CPR, and that's to first call 911 immediately, and second, to perform hard, fast compressions in the middle of the chest until emergency personnel arrives. Of course, it would always be ideal to have like an automated external defibrillator, which is an AED, or a bag mask available. However, that is probably not going to be the case with being a bystander, so therefore you need to know how to perform hands-only CPR. So first, make sure that you assess the scene and make sure that you're not putting yourself in danger to begin with. And then make sure that you maintain fast, hard compressions in the center of the chest, and make sure they're on a flat surface like this. And so you can go deep enough in the chest, so you should go about 2 inches. Perform like 100 compressions a minute is the ideal number to achieve. And you should allow the chest to fully recoil so that appropriate amount of oxygen can be getting back to the heart between every compression. So pushing hard and fast in the middle will help bring the oxygenated blood back, and then to the vital organs as well. So you can sing the song like "Staying Alive," I'm sure we've all heard this, or your ABCs, which is the appropriate rate. So I wouldn't want to put my mouth on someone else's mouth, and I'm sure you probably wouldn't either. So that's why hands-only CPR for this circumstance is the best. So 4 simple steps is you make sure that they're on their back and on a hard surface. You should be positioned like at their neck or at their chest. And so you have one heel of your hand over their chest like this, and then you put your other hand on top here, so then you can put your whole body weight going onto the person, and then you're helping save their life. And make sure that your arms are straight, so then you can fully allow the chest to recoil between every compression. Make sure you don't be scared in the situation, and know that your actions can help to prolong their life of the individual. The order used to be ABCs, which is airway, breathing, and circulation. However, is recently changed to CAB, so compressions, airway, and breathing, because they've learned that compressions are the most critical part of CPR, which is why it's important to perform hard in the center of the chest and fast so that they're getting the correct blood back to the heart. If you're not trained in CPR, that is why hands only is the best alternative, but if you're trained and feel confident, then you could perform chest compressions and then provide rescue breathing if necessary. And make sure to first call 911 and answer all of the dispatcher's questions and let them know where they are, so then EMS could come at a fast pace. So as a bystander, you're not usually going to have access to an AED, which is why hands-only CPR is your best alternative. And remember the impact of fast, hard compressions in the middle of the chest with limited to no interruptions between. So attend a CPR class today to help save someone's life.